Welcome to this video entitled, Diabetes Mellitus, Pathophysiology and Management. In Part 1, we will discuss an overview, pathophysiology, and Type 1 diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder that affects how the body processes sugar. It happens when glucose levels in the blood become too high. This condition is commonly known as hyperglycemia. Glucose is an important source of energy for the body, but without proper control, too much glucose can damage organs and tissues over time. That is why diabetes needs long-term management and care. The disease develops when the body cannot produce enough insulin. Insulin is the hormone that helps move sugar from the blood into the cells. In some people, the body still makes insulin, but the cells stop responding to it properly. This problem is called insulin resistance. Diabetes mellitus is not just one single condition. There are different types, and each works in a slightly different way. Type 1 diabetes mellitus happens when the immune system attacks the insulin-producing cells in the pancreas. As a result, the body produces little or no insulin at all. People with type 1 diabetes mellitus usually need insulin therapy every day to survive. Type 2 diabetes mellitus is more common and often develops gradually over time. In this type, the body becomes resistant to insulin, or it cannot make enough insulin to keep blood sugar normal. Lifestyle factors, genetics, and overall health can all play a role in its development. Common symptoms of diabetes may include frequent thirst, tiredness, blurred vision, and frequent urination. Some people may also notice slow wound healing or unexplained weight changes. If left unmanaged, diabetes can lead to serious complications. These may affect the heart, kidneys, eyes, nerves, and blood vessels. The good news is that early diagnosis and proper treatment can greatly improve quality of life. Healthy eating, regular exercise, medication, and blood sugar monitoring are key parts of diabetes management. With the right care and awareness, many people with diabetes mellitus can live active and healthy lives. Insulin plays a major role in keeping the body's glucose levels balanced and stable. It is a hormone produced by the beta cells of the pancreas. Without insulin, the body cannot properly use glucose for energy. Think of insulin as a key. It unlocks the body's cells and allows glucose to move from the bloodstream into the cells where it can be used. This process is essential for normal body function and daily energy production. Insulin is also the principal hormone responsible for proper cellular utilization of glucose. In simple terms, it helps the body use sugar efficiently instead of letting it build up in the blood. When insulin works properly, blood glucose levels stay within a healthy range. Another important function of insulin is reducing glucose production by the liver. The liver naturally stores and releases glucose when the body needs energy. But insulin signals the liver to slow down glucose release when enough sugar is already present in the bloodstream. This helps prevent dangerously high blood sugar levels. Insulin also supports growth and repair inside the body. It promotes protein synthesis, which means it helps the body build and repair muscles and tissues. This is one reason insulin is considered an anabolic hormone. It helps the body store nutrients and use them effectively. In addition, insulin helps the body store fat instead of breaking it down too quickly. This process provides energy reserves that the body can use later when needed. Without enough insulin, the body may start breaking down fat excessively, which can lead to serious health problems over time. Normal glucose metabolism depends on a careful balance between insulin, glucose intake, and energy use. After eating, blood sugar levels rise. The pancreas then releases insulin to help move glucose into the cells. As glucose levels fall back to normal, insulin production also decreases. This constant balance keeps the body functioning smoothly. It supports energy production, organ function, and overall health. When insulin production or insulin action becomes impaired, conditions like diabetes mellitus can develop. Understanding insulin is important because it shows how the body carefully manages energy every single day. Even small disruptions in this system can affect overall health and well-being. Type 1 diabetes mellitus is a chronic condition that affects how the body produces insulin. It is sometimes called insulin-dependent diabetes because the body cannot make enough insulin on its own. In the past, it was also known as juvenile diabetes. That is because it commonly develops during childhood or the teenage years. However, adults can develop it too. This condition happens when the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. Over time, these cells become damaged and stop working properly. As a result, the body produces little or no insulin at all. Without insulin, glucose cannot enter the body's cells efficiently. Instead, sugar stays in the bloodstream and builds up to dangerous levels. This leads to high blood glucose, also known as hyperglycemia. People with type 1 diabetes mellitus need lifelong insulin supplementation to survive. Insulin may be taken through injections or insulin pumps. This treatment helps the body regulate blood sugar and use glucose for energy. Type 1 diabetes mellitus often develops rapidly. Symptoms can appear suddenly over a few days or weeks. Many people notice the warning signs before they even realize what is happening. One common symptom is polyuria, which means frequent urination. The body tries to remove excess glucose through urine, causing people to urinate more often. Another symptom is polydipsia, or excessive thirst. Because the body loses more fluids, dehydration can quickly develop. This makes people feel thirsty almost all the time. Polyphagia, or increased hunger, is also common. Even though glucose is present in the blood, the cells cannot use it properly for energy. As a result, the body keeps signaling for more food. Unexplained weight loss may also occur. The body begins breaking down fat and muscle for energy because glucose cannot enter the cells effectively. Some people may also feel tired, weak, or experience blurred vision. These symptoms can interfere with school, work, and daily activities. Although type 1 diabetes mellitus is a serious condition, modern treatment has greatly improved quality of life. With proper insulin therapy, healthy eating, regular exercise, and blood sugar monitoring, many people live active and healthy lives. Understanding the early signs is extremely important. Early diagnosis and treatment can help prevent dangerous complications and support long-term health. Insulin therapy is one of the most important treatments for people living with type 1 diabetes mellitus. Because the body produces little or no insulin, replacement insulin is needed every single day. Without it, the body cannot properly control blood glucose levels. Treatment usually involves a strict and carefully planned routine. This includes healthy eating, regular physical activity, and multiple daily insulin injections. The goal is to keep blood sugar levels as close to normal as possible. Managing type 1 diabetes mellitus is not just about taking insulin. It also requires balance, consistency, and daily monitoring. People often need to pay attention to meals, exercise, stress, and even sleep patterns. Insulin preparations are classified according to how quickly they work and how long their effects last. Some insulin types act very fast and begin lowering blood sugar within minutes. These are often called rapid-acting insulin. They are commonly taken before meals to control the rise in blood sugar after eating. Other insulin types work more slowly and provide longer-lasting control throughout the day or night. These are known as intermediate-acting or long-acting insulin. They help maintain stable blood glucose levels between meals and during sleep. Many people use a combination of different insulin types. This approach is designed to mimic how a healthy pancreas normally releases insulin. Doctors choose insulin plans based on each person's lifestyle, age, activity level, and medical needs. Insulin dosing is highly individualized. There is no single dose that works for everyone. Blood glucose monitoring helps determine how much insulin is needed at different times of the day. Some people may use sliding scale insulin therapy. In this method, insulin doses are adjusted based on current blood sugar readings. This allows more flexibility and better glucose control in certain situations. Technology has also improved diabetes management. Many people now use insulin pens, insulin pumps, or continuous glucose monitors. These tools can make treatment more accurate and convenient. Like any medical treatment, insulin therapy may have side effects. The most common adverse reaction is hypoglycemia, also known as low blood sugar. This happens when glucose levels drop too low. Symptoms of hypoglycemia may include sweating, shaking, dizziness, hunger, confusion, or weakness. In severe cases, it can become dangerous if not treated quickly. That is why people using insulin must regularly monitor their blood sugar levels. Although insulin therapy requires commitment and daily attention, it has transformed the lives of millions of people worldwide. With proper treatment, education, and support, people with type 1 diabetes mellitus can live active, healthy, and productive lives. Diabetic ketoacidosis, often called DKA, is a serious and potentially life-threatening complication of diabetes mellitus. It happens when the body does not have enough insulin to use glucose properly for energy. Without insulin, the body begins searching for another fuel source. Instead of using glucose, it starts breaking down fat very rapidly. This process produces chemicals called ketones. Ketones can be useful in small amounts. But when too many build up in the blood, they become dangerous. The blood starts becoming too acidic, which disrupts the body's normal balance. At the same time, blood glucose levels rise to very high levels. Because glucose cannot enter the cells, it stays trapped in the bloodstream. This causes severe hyperglycemia. The kidneys then try to remove the extra glucose through urine. As a result, the body loses large amounts of water and electrolytes. This can quickly lead to dehydration. People with diabetic ketoacidosis may feel extremely thirsty and weak. They may also experience frequent urination, nausea, vomiting, or abdominal pain. Some people develop deep, rapid breathing as the body tries to correct the acid imbalance. In severe cases, confusion or loss of consciousness may occur. That is why diabetic ketoacidosis is considered a medical emergency and requires immediate treatment. Several factors can trigger diabetic ketoacidosis. Missing insulin doses is one common cause. Infections, severe illness, physical stress, or undiagnosed diabetes mellitus can also increase the risk. Treatment focuses on correcting the body's chemical imbalance step by step. One major part of treatment is replacing lost fluids. This helps improve circulation and reduce dehydration. Doctors also give insulin, usually low-dose regular insulin, to lower blood glucose levels safely. As insulin begins working, glucose can move back into the cells for energy. This also slows down ketone production. Another important part of treatment is correcting acidosis and restoring electrolyte balance. Electrolytes like potassium are carefully monitored because they are essential for heart and muscle function. With prompt medical care, most people recover well from diabetic ketoacidosis. However, early recognition is extremely important. Delaying treatment can lead to serious complications and become life-threatening. Understanding diabetic ketoacidosis helps people with diabetes mellitus recognize warning signs early. Quick action, proper insulin use, and regular blood glucose monitoring can greatly reduce the risk of this dangerous condition. In Part 2, we will discuss Type 2 diabetes mellitus, its complications, and management. Type 2 diabetes mellitus is the most common form of diabetes worldwide. In fact, it accounts for about 90 to 95% of all diabetes mellitus cases. Millions of people live with this condition every day. This type of diabetes mellitus develops when the body cannot use insulin effectively. This problem is known as insulin resistance. At the same time, the pancreas may also produce less insulin over time. Normally, insulin helps glucose move from the bloodstream into the body's cells. But in Type 2 diabetes mellitus, the cells stop responding properly to insulin. As a result, glucose begins building up in the blood. Unlike Type 1 diabetes mellitus, Type 2 diabetes mellitus usually develops slowly. The onset is often gradual and sometimes difficult to notice at first. Many people may live with it for years before receiving a diagnosis. Symptoms are often milder in the early stages. Some people may feel tired more often than usual. Others may notice increased thirst, frequent urination, or blurred vision. Slow wound healing and repeated infections can also occur. Several risk factors increase the chance of developing Type 2 diabetes mellitus. Obesity is one of the biggest contributors. Excess body fat can make insulin resistance worse over time. Age is another important factor. Type 2 diabetes mellitus commonly occurs after the age of 40, although younger adults and even children can develop it today. Modern lifestyles and reduced physical activity have increased cases in younger age groups. Family history also plays a major role. People with close relatives who have diabetes mellitus may have a higher risk of developing the condition themselves. Another important risk factor is impaired glucose tolerance. This means blood sugar levels are already higher than normal, but not yet high enough to be classified as diabetes. It is often considered a warning sign. Lifestyle habits strongly influence the development of Type 2 diabetes mellitus. Poor diet, lack of exercise, chronic stress, and inadequate sleep can all affect blood sugar control. The good news is that Type 2 diabetes mellitus can often be managed effectively. Healthy eating, regular exercise, weight management, and medication can help control blood glucose levels. Some people may also require insulin therapy if other treatments are not enough. Early diagnosis is extremely important. Managing blood sugar early can help prevent complications involving the heart, kidneys, eyes, and nerves. Understanding Type 2 diabetes mellitus helps people make healthier choices and reduce long-term health risks. Small lifestyle changes can make a big difference over time. Type 2 diabetes mellitus develops when the body can no longer use insulin efficiently. Over time, insulin resistance makes it harder for glucose to enter the cells. As a result, blood sugar levels begin to rise. Unlike Type 1 diabetes mellitus, the body still produces insulin in Type 2 diabetes mellitus. The problem is that the insulin does not work as effectively as it should. Eventually, the pancreas may also become unable to produce enough insulin to keep up with the body's needs. One of the biggest goals of treatment is improving insulin sensitivity. This means helping the body respond better to insulin again. Lifestyle changes are often the first and most important step. Healthy eating plays a major role in blood sugar control. Balanced meals with controlled portions can help prevent sudden spikes in glucose levels. Foods high in fiber, vegetables, whole grains, and lean proteins are often recommended. Regular exercise is also extremely important. Physical activity helps the muscles use glucose more efficiently for energy. It can also improve insulin sensitivity and support healthy weight management. For many people, weight reduction can make a huge difference. Even modest weight loss may significantly improve blood sugar control. In some cases, it can even delay the progression of diabetes mellitus complications. When lifestyle changes are not enough, medications may be needed. One commonly used medication is metformin. Metformin helps lower glucose production in the liver and improves insulin sensitivity. Another group of medications is sulfonylureas. These drugs stimulate the pancreas to release more insulin. They are often used when the body still has some insulin-producing ability. Doctors may prescribe one medication or combine several treatments depending on the patient's condition. Treatment plans are personalized because every person responds differently to therapy. Blood sugar monitoring is another key part of management. Tracking glucose levels helps patients and healthcare providers understand how well treatment is working. It also helps prevent dangerously high or low blood sugar levels. Type 2 diabetes mellitus management is not only about medication. It also involves long-term lifestyle habits and daily self-care. Stress management, proper sleep, and routine medical checkups all play important roles. If left uncontrolled, Type 2 diabetes mellitus can damage blood vessels and organs over time. Complications may affect the heart, kidneys, eyes, and nerves. That is why early treatment and consistent management are so important. The good news is that many people successfully manage Type 2 diabetes mellitus and live healthy lives. With education, support, and healthy choices, blood sugar can often be controlled effectively for many years. Chronic complications of diabetes develop slowly over time, especially when blood sugar levels stay high for many years. These complications can affect almost every part of the body and may become life-threatening if not properly managed. That is why long-term diabetes care is just as important as daily treatment. One major concern is damage to the heart and blood vessels. People living with diabetes mellitus have a much higher risk of heart attacks and strokes. Excess sugar in the bloodstream can damage blood vessels, making it harder for blood to flow properly. Over time, this increases pressure on the heart and raises the chance of serious cardiovascular disease. Diabetes mellitus can also damage the body's tiny blood vessels, leading to what are called microvascular complications. The eyes are especially vulnerable. High blood sugar can injure the delicate vessels in the retina, eventually causing blurred vision or even blindness if left untreated. Regular eye examinations are important because early damage may not cause noticeable symptoms at first. The kidneys are another common target of long-term diabetes mellitus complications. Since the kidneys filter waste from the blood, constantly elevated glucose levels force them to work harder. Over time, this strain can lead to progressive kidney disease and, in severe cases, kidney failure. Nerve damage, known as diabetic neuropathy, is another serious complication. Many people experience numbness, tingling, burning sensations, or pain, especially in the feet and legs. Because of reduced sensation, small injuries may go unnoticed and untreated. Poor blood circulation makes the situation even more dangerous. Wounds on the feet may heal very slowly, increasing the risk of infection. In severe cases, tissue damage becomes so serious that lower limb amputation may be necessary. The good news is that many chronic complications of diabetes mellitus can be delayed or prevented. Healthy eating, regular exercise, blood sugar control, routine medical checkups, and taking medications correctly all play an important role in protecting the body over time. Oral anti-diabetic drugs are commonly used to treat type 2 diabetes mellitus when lifestyle changes alone are no longer enough. In many patients, healthy eating and regular exercise help at first. But over time, the body may still struggle to control blood sugar levels effectively. That is when oral medications become an important part of treatment. Different groups of oral anti-diabetic drugs work in different ways. Some help the pancreas release more insulin. Others improve how the body responds to insulin or reduce the amount of glucose produced by the liver. One important group is the sulfonylureas. These drugs lower blood glucose by stimulating the pancreatic beta cells to release more insulin into the bloodstream. As insulin levels rise, more glucose moves from the blood into the body's tissues, helping to reduce hyperglycemia. Sulfonylureas are often effective, especially in the early stages of type 2 diabetes mellitus when the pancreas is still capable of producing insulin. However, because they increase insulin release, they can sometimes cause hypoglycemia, especially if meals are skipped or delayed. Another major group is the biguanades, with metformin being the most widely used example. Metformin works differently from sulfonylureas. Instead of forcing the pancreas to release more insulin, it mainly reduces glucose production by the liver. This helps lower the amount of sugar entering the bloodstream. Metformin also improves insulin sensitivity. This means body tissues respond better to insulin already present in the body. As a result, glucose is used more efficiently by muscles and other tissues. One reason metformin is so popular is that it usually does not cause significant weight gain. In some patients, it may even support modest weight reduction. It also carries a lower risk of hypoglycemia compared to drugs that directly stimulate insulin release. Despite its benefits, metformin must be used carefully in certain patients. It carries a rare but very serious risk called lactic acidosis. This condition occurs when lactic acid builds up in the body and can become life-threatening. The risk is much higher in patients with kidney dysfunction because the kidneys help remove metformin from the body. If kidney function declines, the drug may accumulate and increase the danger of toxicity. That is why kidney function should always be monitored during treatment. Overall, oral anti-diabetic drugs play a major role in controlling type 2 diabetes mellitus and helping patients prevent long-term complications. Oral anti-diabetic drugs work in many different ways to help control blood sugar in patients with type 2 diabetes mellitus. When diet, exercise, and a single medication are no longer enough, doctors may combine different drugs to achieve better glucose control. One important group is the alpha-glucosidase inhibitors. These drugs work inside the small intestine by slowing down the digestion and absorption of carbohydrates from food. Because carbohydrates are broken down more slowly, glucose enters the bloodstream at a slower rate after meals. This helps reduce sharp spikes in blood sugar that commonly occur after eating. These medications are usually taken with meals so they can act directly on carbohydrates during digestion. Some patients may experience side effects such as bloating, gas, or abdominal discomfort because undigested carbohydrates remain in the intestine longer. Another group is the meglitinates. These drugs stimulate the pancreas to release insulin very quickly. Their action is rapid but short-lasting, making them especially useful for controlling blood sugar around mealtimes. Because meglitinates work fast, they must be taken shortly before meals. If a meal is skipped, the medication is usually skipped as well to reduce the risk of hypoglycemia. Their quick action helps the body handle the sudden rise in blood glucose that occurs after eating. Thiazolidinediones work differently from both alpha-glucosidase inhibitors and meglitinates. Instead of increasing rapid insulin release, they improve the body's response to insulin. These drugs decrease insulin resistance, which is one of the major problems in type 2 diabetes mellitus. When insulin resistance decreases, body tissues become more sensitive to insulin already present in the bloodstream. Muscle cells are then able to absorb and use more glucose for energy. This helps lower blood sugar levels more effectively over time. Thiazolidinediones mainly improve insulin-dependent glucose uptake in muscles and other peripheral tissues. However, they may take several weeks before their full effect becomes noticeable. Some patients may also experience fluid retention or weight gain during treatment. In many patients, a single oral anti-diabetic drug eventually becomes insufficient to maintain normal glucose levels. Diabetes mellitus is a progressive disease, and the body's ability to regulate glucose may decline over time. For this reason, combination therapy is often used. Doctors may combine drugs from different classes so they can target multiple problems at the same time. One medication may reduce glucose production, another may improve insulin sensitivity, while another controls blood sugar after meals. This combined approach often provides better glucose control and helps reduce the risk of long-term diabetic complications. Gestational diabetes is a type of high blood sugar that develops during pregnancy. It happens when the body cannot use insulin as effectively as it should. This condition is usually diagnosed during the second or third trimester. During pregnancy, hormones help the baby grow and develop. But those same hormones can also make it harder for insulin to work properly. As a result, glucose begins to build up in the bloodstream. Some women have a higher risk of developing gestational diabetes. Risk factors include obesity and a family history of diabetes. Advanced maternal age can also increase the chances. A previous history of gestational diabetes raises the risk too. Many women may not notice obvious symptoms at first. That is why routine prenatal screening is so important. Doctors often test blood sugar levels during pregnancy checkups. Early detection helps protect both mother and baby. When managed properly, most pregnancies remain healthy and safe. Treatment may include healthy eating and regular physical activity. Some women may also need insulin or medication to control blood sugar. Managing gestational diabetes lowers the risk of complications. It can reduce the chances of high birth weight in the baby. It also helps prevent difficult deliveries and premature birth. After pregnancy, blood sugar levels often return to normal. However, mothers who had gestational diabetes have a higher risk of developing type 2 diabetes mellitus later in life. That is why long-term healthy habits are very important. Simple lifestyle changes can make a big difference. Balanced meals, exercise, and regular medical follow-ups help keep blood sugar under control. With proper care, both mother and baby can thrive throughout pregnancy and beyond. Gestational diabetes happens when pregnancy hormones interfere with the way insulin works. This makes it harder for the body to control blood sugar levels. As glucose builds up in the bloodstream, both mother and baby can be affected. Many women are surprised to learn they have gestational diabetes. That is because some mothers may not notice any symptoms at all. The condition can develop quietly during pregnancy. When symptoms do appear, they may seem mild at first. Some women experience excessive thirst throughout the day. Others may notice frequent urination or constant fatigue. Blurred vision can also happen when blood sugar levels become too high. These symptoms are easy to confuse with normal pregnancy changes. That is why routine prenatal screening is extremely important. Doctors do not rely on symptoms alone to make a diagnosis. Healthcare providers usually perform glucose screening tests during pregnancy. If the results are abnormal, an oral glucose tolerance test may follow. These tests help measure how the body handles sugar over time. Early diagnosis makes a huge difference. It allows doctors and mothers to start treatment before complications develop. Managing blood sugar early helps support a healthier pregnancy. Treatment often begins with simple lifestyle changes. Healthy meals and regular physical activity can improve blood sugar control. Some women may also need insulin or other medications during pregnancy. Routine prenatal care plays a major role in keeping both mother and baby safe. Regular checkups help doctors monitor growth and track blood sugar levels closely. This helps reduce risks such as high birth weight and delivery complications. The good news is that gestational diabetes can usually be managed successfully. With proper care, most women go on to have healthy pregnancies and healthy babies. Awareness, screening, and early action are the keys to better outcomes. Managing gestational diabetes starts with healthy daily habits. In many cases, lifestyle changes are the first line of treatment. Simple choices can make a huge difference for both mother and baby. Healthy eating plays a major role in blood sugar control. Balanced meals help keep glucose levels steady throughout the day. Doctors often recommend meals with controlled carbohydrate intake. This helps prevent sudden spikes in blood sugar after eating. Regular physical activity is also very important during pregnancy. Light exercises like walking can help the body use insulin more effectively. Exercise also supports healthy weight management and improves energy levels. Blood sugar monitoring is another key part of treatment. Checking glucose levels regularly helps track how well the plan is working. It also helps healthcare providers adjust treatment when needed. Some women may need more than diet and exercise alone. If blood sugar remains high, insulin or other medications may be required. These treatments help keep glucose levels within a safer range during pregnancy. Prenatal care becomes even more important with gestational diabetes. Regular clinic visits allow doctors to monitor both mother and baby closely. These appointments help track fetal growth and overall pregnancy health. Proper management lowers the risk of complications. It can reduce the chances of premature birth and difficult delivery. Good glucose control also helps prevent excessive birth weight in the baby. The good news is that gestational diabetes is manageable. With the right support, most women go on to have healthy pregnancies. Healthy habits, regular monitoring, and medical guidance are the foundation of successful treatment. Every small step matters during pregnancy. A healthy meal, a short walk, or checking blood sugar can all make a difference. When mothers stay informed and proactive, they give themselves and their babies the best possible start. Gestational diabetes can lead to serious complications if it is not properly managed. High blood sugar during pregnancy can affect both the mother and the baby. That is why early diagnosis and consistent care are so important. One major concern is excessive birth weight. When too much glucose reaches the baby may grow larger than normal. This can increase the risk of difficult labor and delivery complications. Babies born to mothers with gestational diabetes may also develop low blood sugar after birth. This happens because the baby's body becomes used to producing extra insulin during pregnancy. After delivery, blood sugar levels can suddenly drop. The effects of gestational diabetes may continue even after pregnancy ends. Mothers who experience this condition have a higher risk of developing type 2 diabetes mellitus later in life. This makes long-term health monitoring very important. The good news is that many of these risks can be reduced. Healthy lifestyle choices play a powerful role in prevention and management. Maintaining a healthy weight before and during pregnancy can improve blood sugar control. Regular physical activity also helps the body use insulin more effectively. Simple activities like walking or light exercise can make a big difference. Exercise supports both maternal health and healthy fetal development. Prenatal checkups are another essential part of prevention. Routine visits allow healthcare providers to monitor blood sugar and track the baby's growth. These appointments help detect problems early before complications develop. For most women, blood sugar levels return to normal after delivery. However, follow-up care is still very important after pregnancy. Doctors may recommend future glucose testing to monitor long-term health. Gestational diabetes can feel overwhelming at first, but with proper care, education, and support, it is highly manageable. Healthy habits during pregnancy can protect both mother and baby now and in the future. Insulin plays a central role in diabetes management. It helps the body move glucose from the bloodstream into the cells, where it can be used for energy. At the same time, insulin lowers the amount of glucose released by the liver. This keeps blood sugar levels more stable throughout the day. Insulin is used in several forms of diabetes. It is essential for people with type 1 diabetes mellitus because their bodies cannot produce insulin naturally. It is also commonly used in advanced type 2 diabetes mellitus, when the body no longer responds well to other treatments. Doctors may also prescribe insulin during diabetic ketoacidosis, often called DKA, which is a serious medical emergency. In some cases, insulin is needed during pregnancy to help manage gestational diabetes and protect both mother and baby. There are different types of insulin, and each works at a different speed. Rapid-acting insulin starts working quickly and is often taken before meals to control blood sugar spikes. Short-acting insulin works a little more slowly but serves a similar purpose. Intermediate-acting insulin lasts longer and helps control glucose levels between meals and overnight. Long-acting insulin provides steady blood sugar control for an entire day or longer. One of the key benefits of insulin therapy is better control of postprandial glucose spikes. These are the rises in blood sugar that happen after eating. By controlling these spikes, insulin helps reduce the risk of long-term complications linked to diabetes. Like all medications, insulin can also have side effects. One major risk is hypoglycemia, which means blood sugar drops too low. Symptoms can include sweating, shakiness, confusion, and dizziness. Another common effect is weight gain, especially when insulin use improves the body's ability to store glucose and energy. Even with these challenges, insulin remains one of the most effective tools for managing diabetes mellitus. When used correctly, it can improve daily health, prevent complications, and help people live longer and healthier lives. Dipeptide L-peptidase 4 inhibitors, abbreviated as DPP-4 inhibitors, are a popular group of drugs used to manage type 2 diabetes. They help the body control blood sugar in a smarter and more natural way. These medicines work by blocking an enzyme called dipeptide L-peptidase 4. This enzyme normally breaks down incretin hormones in the body. One important incretin hormone is glucagon-like peptide 1, abbreviated as GLP-1. When incretin hormones stay active longer, the pancreas releases more insulin after meals. At the same time, the liver releases less glucagon. That means the body produces less extra glucose. The result is better blood sugar control throughout the day. And because the effect depends on glucose levels, the risk of severe hypoglycemia is usually low. Several common drugs belong to this group. Examples include sitagliptin, saxagliptin, linagliptin, and vildagliptin. These medications are widely prescribed around the world. One major advantage is convenience. Most dipeptide L-peptidase 4 inhibitors are taken orally as tablets. That makes them easier for many patients to use compared to injectable treatments. Another benefit is tolerability. Most patients handle these drugs quite well. Side effects are usually mild and manageable. Doctors often use dipeptide L-peptidase 4 inhibitors in people with type 2 diabetes mellitus, who need better glucose control but want a lower risk of low blood sugar episodes. They may also be combined with other diabetes mellitus medications for stronger results. Even though these drugs are effective, lifestyle changes still matter. Healthy eating, regular exercise, and weight control remain essential parts of diabetes care. Overall, dipeptide L-peptidase 4 inhibitors offer a balanced and patient-friendly approach to managing type 2 diabetes mellitus. They improve insulin response, reduce excess glucose production, and help patients maintain more stable blood sugar levels with fewer complications. Glucagon-like peptide 1, abbreviated as GLP-1 receptor agonists, are an important group of medications used to treat type 2 diabetes mellitus. They are becoming increasingly popular because they help control blood sugar and support weight loss at the same time. Examples of these medications include exenatide, liraglutide, dulaglutide, and semaglutide. Many people may recognize semaglutide because it is widely discussed for both diabetes and obesity treatment. These drugs work by mimicking a natural hormone in the body called glucagon-like peptide 1. This hormone is normally released after eating. It helps the body respond to food more effectively. Glucagon-like peptide 1 receptor agonists stimulate the pancreas to release insulin when blood sugar levels rise. That means the body can lower glucose levels in a more controlled and natural way. At the same time, these medications reduce the release of glucagon. Glucagon is a hormone that tells the liver to release stored glucose. By lowering glucagon levels, less sugar enters the bloodstream. Another major effect is slower gastric emptying. In simple terms, food leaves the stomach more slowly. This helps people feel full for longer after meals. Because of this effect, many patients experience reduced appetite and gradual weight loss. That makes glucagon-like peptide 1 receptor agonists especially useful for people with type 2 diabetes mellitus who also struggle with obesity. Research also shows these drugs may provide cardiovascular protection. Some patients using these medications have lower risks of heart attacks and strokes. That is a huge advantage because diabetes often increases the risk of heart disease. Like all medications, glucagon-like peptide 1 receptor agonists can have side effects. The most common ones are nausea and vomiting. Some people may also experience bloating or stomach discomfort, especially when starting treatment. Doctors usually begin with lower doses and increase them gradually. This helps the body adjust and reduces unwanted side effects. Overall, Glucagon-like peptide-1 receptor agonists have changed the way type 2 diabetes mellitus is managed. They improve blood sugar control, support weight reduction, and may even protect the heart. For many patients, they offer a powerful and modern approach to long-term diabetes mellitus care. Choosing the right diabetes medication is not always simple. Different drug classes work in different ways, and each one comes with its own strengths and challenges. Insulin is known for having the strongest glucose-lowering effect. It works quickly and effectively to reduce blood sugar levels. That is why insulin is essential in type 1 diabetes mellitus and often needed in advanced type 2 diabetes mellitus. But insulin therapy also requires careful monitoring. One important concern is hypoglycemia, or low blood sugar. This can happen if too much insulin is taken or meals are skipped. Symptoms may include sweating, shaking, confusion, and dizziness. Another major group is dipeptide L-peptidase 4 inhibitors. These drugs are popular because they are convenient oral medications. Patients can usually take them as tablets once daily. Dipeptide L-peptidase 4 inhibitors also tend to be weight neutral. That means they usually do not cause significant weight gain or weight loss. For many patients, this makes them easier to tolerate long-term. Then we have glucagon-like peptide-1 receptor agonists. These medications have gained huge attention in recent years. One reason is their ability to promote significant weight loss. Glucagon-like peptide-1 agonists help people feel fuller for longer after meals. They also reduce appetite and improve insulin release. This combination helps lower blood sugar while supporting weight reduction. Some glucagon-like peptide-1 medications may also protect the heart. That is especially important because diabetes increases cardiovascular risk. Even with all these options, no single treatment works for everyone. Doctors must consider many patient-specific clinical factors. Age matters. Weight matters. Kidney function matters too. Some patients may need stronger glucose control. Others may prioritize weight loss or convenience. And some may need to avoid medications that increase hypoglycemia risk. This is why diabetes treatment is highly individualized. The goal is not just lower blood sugar. The goal is better overall health and quality of life. Modern diabetes mellitus care now offers many effective treatment choices. And with the right combination of medication, lifestyle changes, and monitoring, patients can achieve much better long-term outcomes. Modern diabetes mellitus care has advanced tremendously over the years. Today, treatment is no longer focused only on lowering blood sugar. The goal is to protect the entire body, improve quality of life, and prevent long-term complications. Several important drug classes now play a major role in diabetes management. Insulins remain essential, especially for patients with type 1 diabetes mellitus and for many individuals with advanced type 2 diabetes mellitus. Insulin therapy helps replace or supplement the body's natural insulin when the pancreas can no longer produce enough. Different insulin preparations work at different speeds and durations. Some act rapidly to control blood sugar after meals, while others provide longer-lasting control throughout the day and night. This flexibility allows treatment to be adjusted according to each patient's needs. Dipeptide peptidase 4 inhibitors are another important group of anti-diabetic medications. These drugs help increase the levels of natural incretin hormones in the body. Incretins stimulate insulin release when blood glucose rises after meals and also reduce excessive glucagon secretion. Because their action depends on glucose levels, dipeptide peptidase 4 inhibitors generally carry a lower risk of severe hypoglycemia. They are often well tolerated and may be used alone or in combination with other medications. Glucagon-like peptide-1 receptor agonists have also transformed diabetes mellitus treatment. These drugs mimic the action of the natural glucagon-like peptide-1 hormone. They stimulate insulin release, slow gastric emptying, suppress glucagon secretion, and help patients feel full for longer periods after eating. Many patients using glucagon-like peptide-1 agonists experience improved glucose control together with weight reduction. Some drugs in this class have also shown cardiovascular benefits, making them especially valuable for patients with heart disease risk factors. Each class of anti-diabetic medication provides unique therapeutic advantages. Some mainly improve insulin sensitivity, others increase insulin release, while others slow glucose absorption or reduce appetite. Because diabetes affects patients differently, treatment must be carefully individualized. Modern diabetes mellitus management focuses on personalized care. Doctors consider factors such as age, weight, kidney function, cardiovascular risk, lifestyle, and blood glucose patterns before selecting therapy. No single treatment plan works for every patient. Despite major advances in medication, lifestyle modification remains one of the most powerful tools in diabetes care. Healthy eating, regular physical activity, weight control, smoking cessation, and stress management all contribute greatly to long-term success. Patient education is equally important. Individuals who understand their disease are better able to monitor symptoms, follow treatment plans, recognize complications early, and make healthier daily decisions. Regular monitoring of blood glucose, kidney function, eye health, and cardiovascular status helps detect problems early and reduces the risk of serious long-term diabetic complications. In Section 2, we will do case reviews. A 14-year-old boy arrives at the clinic with symptoms that have been getting worse over the last few weeks. He has been feeling constantly thirsty and is urinating more often than usual. He has also experienced unexplained weight loss, despite eating normally. These symptoms are classic warning signs of diabetes mellitus. Laboratory tests later confirm severe hyperglycemia, meaning his blood sugar levels are extremely high. At his age, the most likely diagnosis is type 1 diabetes mellitus. This form of diabetes mellitus commonly develops during childhood or adolescence. It happens when the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. As these cells become damaged, the body can no longer produce enough insulin. Without insulin, glucose cannot properly enter the cells to be used for energy. Instead, sugar builds up in the bloodstream, leading to hyperglycemia. One major symptom is polydipsia, or excessive thirst. The body loses large amounts of water through frequent urination because the kidneys try to remove extra glucose from the blood. This causes dehydration and makes the person feel thirsty almost constantly. Another common symptom is polyuria, which means frequent urination. High blood glucose pulls extra water into the urine, increasing fluid loss from the body. Weight loss is also very common in type 1 diabetes mellitus. Even though glucose is present in the bloodstream, the cells cannot use it effectively for energy. As a result, the body starts breaking down fat and muscle for fuel. Many people with type 1 diabetes mellitus also feel tired and weak. This happens because the body's cells are essentially starving for energy. The diagnosis in this case is not type 2 diabetes mellitus. Type 2 diabetes mellitus is more common in adults and is usually linked to insulin resistance and obesity. This patient's young age and rapid onset of symptoms strongly suggest type 1 diabetes mellitus instead. Conditions like diabetes insipidus or maturity onset diabetes of the young may share some symptoms, but they do not typically present with severe hyperglycemia and rapid weight loss in this way. Treatment for type 1 diabetes mellitus requires lifelong insulin therapy. Patients must regularly monitor blood sugar levels, follow healthy eating habits, and stay physically active. With proper treatment and education, many people with type 1 diabetes mellitus live healthy and active lives. A patient with type 1 diabetes mellitus suddenly becomes confused and agitated. That should raise concern immediately. The nurse also notices cool, clammy skin. The patient feels weak and extremely hungry. These are classic warning signs of hypoglycemia. Hypoglycemia means the blood glucose level has dropped too low. The brain depends heavily on glucose for energy. When glucose falls, the brain reacts quickly. That is why the patient becomes confused, restless, or irritable. Some patients may even faint or have seizures. The body also releases stress hormones like adrenaline. This causes sweating, shakiness, and a rapid heartbeat. Cool and clammy skin is another important clue. In people with type 1 diabetes mellitus, hypoglycemia often happens when there is too much insulin. It can also occur after skipping meals, exercising heavily, or delaying food intake. Sudden hunger is the body's emergency signal. The body is trying to restore glucose levels quickly. This condition is different from diabetic ketoacidosis, or DKA. Diabetic ketoacidosis usually develops more slowly. Patients with diabetic ketoacidosis often have warm, dry skin and deep breathing. They may also complain of excessive thirst and abdominal pain. Hypoglycemia needs urgent treatment. The priority is to raise the blood sugar immediately. If the patient is awake, give fast-acting carbohydrates. Examples include glucose tablets, fruit juice, or sugary drinks. After that, the blood glucose should be rechecked. A longer-acting carbohydrate snack may also be needed. If the patient is unconscious, intravenous glucose or glucagon may be required. Quick action can prevent serious complications. The correct answer in this scenario is hypoglycemia. The key clues are confusion, weakness, sudden hunger, and cool clammy skin. A 55-year-old obese female is diagnosed with type 2 diabetes mellitus. The physician prescribes metformin as treatment. Metformin is one of the most commonly used anti-diabetic drugs worldwide. It helps lower blood glucose without causing major weight gain. The drug mainly works by reducing glucose production in the liver. It also improves insulin sensitivity in body tissues. That means the body can use insulin more effectively. Most patients tolerate metformin very well. Common side effects include nausea, diarrhea, and abdominal discomfort. These effects are usually mild and temporary. However, there is one rare but serious complication to remember. That complication is lactic acidosis. Lactic acidosis happens when lactic acid builds up in the blood. This condition can become life-threatening if not recognized early. Patients may complain of weakness and fatigue. Some develop muscle pain or difficulty breathing. Others may experience abdominal pain or confusion. The risk increases in patients with kidney disease. It is also more likely in liver disease or severe heart failure. These conditions reduce the body's ability to clear lactic acid. That is why kidney function must be monitored regularly. Doctors often check creatinine and estimated GFR before treatment. Metformin is usually avoided in severe renal impairment. Temporary discontinuation may also be needed before contrast imaging procedures. The question asks for the serious adverse reaction linked to biguanades. Biguanades are the drug class that includes metformin. The correct answer is lactic acidosis. Hypoglycemia is much less common with metformin alone. That is one reason the drug is very popular in type 2 diabetes mellitus. Diabetic ketoacidosis is usually related to insulin deficiency. It is not a common direct effect of metformin. Fluid retention and heart failure are more associated with thiazolidinediones. These are different anti-diabetic medications. So, the key takeaway is simple. Metformin is effective and widely used. But clinicians must always watch for signs of lactic acidosis. A nurse is preparing to administer a mixture of regular insulin and neutral protamine hagedorn insulin, abbreviated as NPH insulin. This is a very common skill in diabetes management. But insulin mixing must follow the correct procedure. Small mistakes can affect blood glucose control. Regular insulin is clear in appearance. Neutral protamine hagedorn insulin looks cloudy because it contains added protein. Before mixing, the cloudy neutral protamine hagedorn vial should be rolled gently. This helps distribute the suspension evenly. Shaking the vial vigorously is avoided. The nurse first injects air into the neutral protamine hagedorn vial. Then air is injected into the regular insulin vial. After that, the nurse withdraws the regular insulin first. This is a very important step. Why does this matter? Because regular insulin must stay uncontaminated. If neutral protamine hagedorn insulin enters the regular insulin vial, it can change how the insulin works. A simple rule is often taught in nursing school. Clear before cloudy. The clear insulin is regular insulin. The cloudy insulin is neutral protamine hagedorn insulin. So, the nurse draws up regular insulin first. Then the neutral protamine hagedorn insulin is drawn afterward. This technique helps maintain insulin accuracy and sterility. It also ensures predictable absorption and glucose control. Some students confuse this sequence during exams. Others think the cloudy insulin should be withdrawn first. That is incorrect. The question asks for the correct procedure when mixing insulin. The best answer is to draw the regular insulin before the neutral protamine hagedorn insulin. Using the correct order protects the effectiveness of the medication. It also improves patient safety during insulin administration. A 60-year-old man with type 2 diabetes mellitus is prescribed acarbose. This drug belongs to a class called alpha-glucosidase inhibitors. These medications work inside the small intestine. They slow down the breakdown of complex carbohydrates into glucose. Because digestion becomes slower, glucose enters the bloodstream more gradually. That means blood sugar spikes after meals are reduced. Acarbose does not force the pancreas to release more insulin. It also does not directly increase insulin sensitivity in body tissues. Instead, its main action happens in the digestive tract. It delays carbohydrate digestion and slows carbohydrate absorption. This helps patients maintain better control of post-meal blood glucose levels. That is especially useful in people with type 2 diabetes mellitus. Patients taking acarbose may notice fewer sharp sugar highs after eating. However, the medication can also cause bloating and gas. Why does that happen? Undigested carbohydrates reach the colon and get fermented by bacteria. So, the correct answer is alpha-glucosidase inhibitors delay the digestion and absorption of carbohydrates in the intestine. A 45-year-old patient with newly diagnosed type 2 diabetes mellitus asks an important question. Why is fasting blood sugar still high after not eating all night? At first, this seems confusing. If no food is entering the body, where is the glucose coming from? The answer lies inside the liver. In type 2 diabetes mellitus, the liver keeps producing glucose even when it should slow down. This process is called gluconeogenesis. It means the body makes new glucose from non-carbohydrate sources. Normally, insulin tells the liver to stop releasing excess glucose during fasting. But in type 2 diabetes mellitus, the body becomes resistant to insulin. That means insulin signals are weaker. The liver does not listen properly anymore. As a result, the liver continues pumping glucose into the bloodstream overnight. This leads to fasting hyperglycemia. Many people think fasting hyperglycemia happens because of food eaten the night before. But that is not the main reason. The major problem is excessive hepatic glucose production. The liver is essentially overactive. Another option mentions autoimmune destruction of beta cells. That is more typical of type 1 diabetes mellitus, not type 2 diabetes mellitus. Some may also think the incretin system is the primary issue here. While incretin hormones are involved in glucose control, they are not the main cause of fasting hyperglycemia. The key mechanism is insulin resistance combined with increased gluconeogenesis. The liver keeps making sugar even when blood glucose is already high. This explains why many patients wake up with elevated glucose levels in the morning. Even without eating, the body is still adding glucose into the blood. So, the correct explanation is this. Fasting hyperglycemia in type 2 diabetes mellitus is mainly caused by increased hepatic glucose output due to excessive gluconeogenesis. A patient comes in for a routine diabetes follow-up. One important test is the glycated hemoglobin test. It is also called HbA1c. This test shows average blood sugar levels. Not just today's reading, but over the past 2 to 3 months. In this case, the HbA1c level is 10.5%. That number is very high. It tells us blood glucose has been poorly controlled. So what does that really mean? It means sugar levels stayed elevated for weeks or months, not just for a single day. The nurse now needs to interpret the result correctly. A high HbA1c does not mean diabetes is cured. It actually suggests the opposite. It also does not mean the patient has low blood sugar. Low glucose would produce different findings. And HbA1c would not usually rise this high. The result also does not prove that treatment is perfect. If therapy were working well, the HbA1c would be lower, usually closer to the target range. The best interpretation is this. The patient's diabetes has been poorly controlled. That is why option B is correct. The elevated HbA1c reflects long-term hyperglycemia. In simple terms, blood sugar stayed too high for too long. This matters because uncontrolled diabetes can damage organs. It can affect the eyes, kidneys, nerves, and heart. And the risk increases over time. That is why HbA1c testing is so useful. It gives a bigger picture of glucose control, much better than a single blood sugar reading. Doctors and nurses use HbA1c to guide treatment decisions. They may adjust medications, recommend lifestyle changes, or improve glucose monitoring. Patients are also encouraged to improve diet habits. Regular exercise can help lower blood sugar. Medication adherence is equally important. So remember this key point. HbA1c reflects long-term glucose control, and a value of 10.5% indicates poor diabetic control over recent months. A patient arrives at the emergency department feeling very ill. There is dizziness and weakness. Breathing is deep, fast, and labored. The patient also has a fruity acetone smell on the breath. That fruity odor is an important clue. It often points toward diabetic ketoacidosis, or DKA. Blood glucose is over 400 milligrams per deciliter. That is severely elevated blood sugar, and it suggests uncontrolled diabetes mellitus. So what is really happening inside the body? The key problem is insufficient insulin activity. Without enough insulin, glucose cannot enter cells properly. Even though sugar is high in the blood, the cells behave as if they are starving. So the body searches for another energy source. Fat breakdown rapidly increases. This process is called lipolysis. Stored fat is converted into free fatty acids. The liver then converts those fatty acids into ketone bodies. Ketones can provide energy during starvation states. But in excess, they become dangerous. Ketones start building up in the bloodstream. This causes metabolic acidosis. The blood becomes too acidic. That is why breathing becomes deep and rapid. The body is trying to remove carbon dioxide. It is a compensation mechanism. The fruity breath odor comes from acetone. Acetone is one of the ketone bodies produced in diabetic ketoacidosis. It escapes through the lungs during exhalation. So the direct pathophysiologic cause is this. Insufficient insulin causes lipolysis and ketone production. That is the central mechanism behind diabetic ketoacidosis. This condition is a medical emergency. Without treatment, dehydration worsens quickly. Electrolyte imbalance can also become life-threatening. Patients may develop confusion or even coma. That is why rapid diagnosis matters. Early treatment can save lives. Treatment usually includes intravenous fluids. Insulin therapy is also essential. Electrolytes like potassium must be monitored closely. Diabetic ketoacidosis is most common in type 1 diabetes mellitus. But it can also occur in type 2 diabetes mellitus, especially during severe illness or infection. So remember the classic signs. High blood glucose, deep rapid breathing, fruity acetone breath, and ketone production caused by insulin deficiency. A patient is prescribed insulin glargine at bedtime. Now the nurse must administer it safely. But one precaution is extremely important. Insulin glargine should not be mixed with other insulin solutions. That is the key teaching point here. And it is critical in clinical practice. So why does this matter? Insulin glargine is a long-acting insulin. It is designed to work slowly over many hours. Its action is smooth and steady. It helps maintain basal insulin levels, usually for about 24 hours. The formulation of glargine is unique. It is acidic in the vial or pen. That acidic environment keeps it stable. When injected into body tissues, the insulin forms tiny precipitates under the skin. These slowly release insulin over time. If glargine is mixed with another insulin, its structure and absorption can change. The predictable action may be lost. That means blood sugar control becomes unreliable. The patient may experience hyperglycemia, or even dangerous hypoglycemia. So the nurse must always give glargine separately. Never combine it in the same syringe, even with other compatible-looking insulins. Now let's look at the incorrect options. Glargine can actually be given at bedtime. That is one of its common administration times. It also does not need vigorous shaking. In fact, shaking insulin aggressively can damage proteins. Most insulin preparations should be handled gently. The statement about avoiding cloudy insulin is also misleading. Some insulins are naturally cloudy. For example, neutral protamine hagedorn insulin appears cloudy normally. But glargine itself is usually clear. If glargine appears cloudy, the solution should not be used. Long-acting insulins play a major role in diabetes mellitus care. They help provide stable glucose control throughout the day and night, especially between meals and during sleep. Patients using insulin need careful education. They must understand timing and injection technique. Storage and medication safety are also essential. Nurses play an important role here. Safe insulin administration prevents complications and improves long-term diabetic management. So remember this key clinical rule. Insulin glargine must never be mixed with other insulin solutions. That is the correct precaution to follow. Insulin resistance in skeletal muscle is one of the earliest problems seen in type 2 diabetes mellitus. And the key issue is not usually the number of insulin receptors. The biggest defect happens inside the muscle cell itself. Normally, insulin sends a signal that moves GLUT4 transporters to the cell's surface. These GLUT4 transporters act like tiny doors. They allow glucose to enter the muscle cell from the bloodstream. In healthy muscle tissue, insulin quickly activates this process. Glucose then moves efficiently into the cells for energy production. But in insulin resistance, this signaling pathway becomes impaired. The GLUT4 transporters do not move properly to the cell membrane. That means glucose stays trapped in the bloodstream, and blood sugar levels begin to rise over time. So, the most fundamental defect is decreased insulin-stimulated GLUT4 translocation. This is considered a hallmark of skeletal muscle insulin resistance. Now, some people think insulin resistance is caused mainly by fewer insulin receptors. But in many patients, receptor numbers are actually close to normal. The real problem is what happens after insulin binds to the receptor. The intracellular signaling system becomes less responsive. Inflammation can also contribute to this process. Cytokines like TNF-alpha interfere with insulin signaling pathways. Excess fatty acids inside muscle cells can worsen the problem too. They disrupt normal metabolic activity and increase oxidative stress. Adiponectin also plays a role in insulin sensitivity. Low adiponectin levels are associated with metabolic disease. But decreased adiponectin secretion is not the primary skeletal muscle defect described here. The central issue remains impaired GLUT4 movement to the cell's surface. Without proper GLUT4 translocation, muscle cells cannot efficiently absorb glucose. And since skeletal muscle is a major site of glucose uptake, the effects become significant. This is why exercise is so beneficial in insulin resistance. Physical activity can stimulate GLUT4 translocation even without insulin. That helps muscle cells take in glucose more effectively, and it improves overall insulin sensitivity over time.